This conference will now be recorded.
Okay.
We all are familiar with Sharma sir, but then also I would like to introduce sir to all of you. Sir, Sharma sir has done his UG from STM Ayurved College, Udupi. He has done his post-graduation from Banaras Hindu University, BHU, in Shalya Tantra. Since 1983, sir are in teaching profession at SDM Ayurved College, Udupi, and after retirement last year, sir are working as a professor and medical superintendent in the same college. Also, sir is practicing, especially in Shalya Tantra, in his private practice since 1983. So now I would request Sharma sir to please take over the mic.
Thank you. Thank you all. Now, the topic which we are going to discuss would be about the wound and wound its clinical assessment and then partially the management. Of course, wound, the word wound, of course, everyone knows the meaning, but technically, many times the word Vrana is considered as a synonym for the wound. Sushruta has defined Vrana in two different ways. One is Vrana Gatra Vichurnane. That's a Vrana is one which produces a disruption over the surface of any tissue or interruption of any of the tissue is a Vrana. Wound, of course. It's a universal definition of the wound. But Sushruta has some more extra definition for the Vrana. Vranoti yasmat rudhopi Vrana vastu nanashyati adeha dharanat tasmat Vrana ityuchyate budhihi. Vrana is the one which may produce a stigma or a change in the tissue which will be there for throughout the life. It's an irreversible pathology, and the lesions, the evidence of the lesion will remain in the body for the whole life, and such is the definition of the Vrana. Now, that word Vrana has a broader meaning than that of the wound from Ayurvedic point of view. Sushruta has used that word Vrana in other contexts also. In the Kriyakala, description of the Kriyakala, the Bheda Kriyakala, the sixth of the Kriyakala, end state where the complications would occur. Sushruta has used the word like a pathology which continues further without a proper interruption can result in a Vrana Bhavam Apannanam, Shastra Kriyakalaha. Now, it is a evidence of Asadhyata, where the condition become incurable. So it's an irreversible pathology. Now, irreversible pathology as such would be either a death of the tissue or a neoplastic change, malignant change, or adaptosis. The three pathologies which are irreversible, as we know, are either the death of the tissue or a malignant change or adaptosis. Adaptosis is a changes in the tissues which occur due to exposure to any strainful situation, and the tissues tend to adapt in that situation. That's the adaptosis. Of course, from our current discussion point of view, we will limit ourselves to the wound as Vrana. The other issues related to the Vrana, the meaning, we'll just keep it in the background. We will not go into the detail of that. Now, as far as this wound as I consider as Vrana, is they are mainly of two categories. Shariraha Agantushta. A Vrana which could be wound which could be produced endogenously from within the body, produced spontaneously as a consequence of the disease manifestation. Contemporary system doesn't accept that a wound can be formed without any injury or as a internal pathology or systemic pathology of a wound. This is not accepted by the contemporary system. But inflammation resulting in a sepsis and then its complications as a wound is accepted. So inflammation is not considered as a endogenous pathology from the current point of view, but Ayurveda considers the inflammation and its consequence as a endogenous pathology. We will come to have some more discussion about that issue. The other is the agantu, a trauma injury produced due to extraneous factors. Now, the differences between these and whenever you have to deal with the wound, it's quite important that you assess the cause of the wound and assess the whole aspect of the wound management or wound conditions, and then only plan the management. From the point of view of assessing the tissue loss and planning the management, the Agantu Vrana are categorized as Chinnam, Bhinnam, Viddham, Kshatam, Pichidam, Ghrishtam. The 6 varieties which are considered from Ayurvedic point of view. From the current clinical point of view also, it's almost exactly the same with very few differences. We'll just see like what are those differences and what are those the factors of individual vranas as such. The Chinna vrana, the definition of Chinna vrana is a wound which results in a separation of part of the body. Gatrasya patanam chapi chinnam ityupadishyate. A wound which results in a gatra patana, separation of a part of the body, and the shape could, irrespective of the shape, this shape could be either straight or oblique. That's considered as a Chinna vrana, which is actually an excised wound. Now, in case of the excised wound, the basic issue is you will be losing a part of the tissue, and hence either you have to think of salvaging that tissue, that's saving that tissue if possible, or you will have to think of a situation where the deformity would be minimum at the end of the healing, and when you are not in a position to save the tissue, somehow you have to see that there will not be any major systemic complication and the deformity will be minimum. And the approach to the management will be depending upon the vitality of the tissue lost. Like suppose if it's a tip of a finger, the important issue which you have to consider like would be what would happen to the stump at the end of your healing. So either if possible, you can save this tip of the finger if situations permit that. If the situation do not permit, because that portion of the tissue which has become separated would not be viable in all conditions. If it is not possible to rejoin them, then you will have to create a stump which will be functionally optimal. But if same may not be true only in all cases, if it is a vital organ, like a vital organ, like the eyes being lost. See, it's not only about that saving of the structure. You will have to think of the possible functionality, and that functional loss will be more. So the approach to the management would be different depending upon the type of the tissue which is involved. But one common feature there is a tissue loss, and the approach would be either salvaging or live with that deformity and as far as possible minimize the deformity. The next variety of the Vrana is the Bhinna Vrana. It's the incised wound. The Bhinna Vrana, incised wound is produced due to pointed instruments like Sushruta has given the example like Kunta, Shakti, Khadgagra, Vishana. These are all the pointed weapons which were used in those days. You may not have exactly the same instruments now being used, but any other pointed instrument which induce a viscera, a cavity of the body, that's considered as Bhinna Vrana. So a penetrating injury involving the cavity. In the contemporary system, you do not have that kind of a subclassification of a penetrating injury involving a cavity or the other way. But Sushruta has made two differences. Two differences are one is involving the cavity and the other is not involving the cavity, the area of the periphery. Now, a cavity involving injury will have some more specific complications. The complication would be the function of that cavity, visceral organ would be affected. So you will have to save that function of the visceral structure as well as you have to manage the wound when it is a Bhinna Vrana. Whereas in the other variety of a penetrating injury described by Sushruta is the Viddha Vrana. Viddha Vrana is again produced due to a similar injury, similar instruments like pointed instruments, a Sukshmasya Shalya, and but the only thing is the structure which is injured may not be a visceral organ. It could be any other area of the body. When a penetrating injury occurs in the other areas other than that of the viscera, like the limb, you may have a point of entry and a point of exit. Uttundism Nigatam. Now, in the present day situation, you have the missile injuries. In the missile injuries, the basic issue will be to identify the point of entry and the point of exit of the missile, and where the features would be the same, like a point of entry would be having a depressed opening, a deep opening. Whereas the exit, you will have a everted edge. The edge will be raised. So either it would be Nirgata or it could be Uttundita. And this is a unique classification of Ayurveda, which contemporary system doesn't make out. See, contemporary system that doesn't make out the differences between a visceral and non-visceral injuries. You have only one variety, penetrating injury. Whereas Sushruta has made two, Bhinna and Viddha, the penetrating injury. The next variety of the injury is the Kshata or the laceration. The features described by Sushruta are Nati Chinnam, Nati Bhinnam, where you will have both the qualities of Chinna as well as Bhinna. So there can be a visceral injury as well as a tissue loss. But at the same time, it may produce a gross deformity or gross injury to the surface of the body, and the surface may become irregular. That kind of injury is called as lacerations or the Kshata Vrana, where the area involved is more. The tissue loss may not be, as far as the size or quantum of the tissue being lost, it may not be same as that of a excised wound, but the area involved would be more. The cells, number of cells which could be damaged also would be more. And among these lacerations, one of the very severe injury which we call now as a Degloving injury, where a vast area of the surface of the body may be lost, and this also is a Shata Vrana. And the approach to the management there would be you'll have to take care of this surface area lost, and the management has to be having idea of covering this surface as the priority. Now, another variety of the injury is the Pittaja Vrana. The Pittaja Vrana is where there is a compression or a contusion, a blunt trauma, which can produce a compression of the tissue. Prahara Pidanabhyam to Yadangam Pratutangatam, where it becomes flattened. And because you will have multiple tissues involved, including maybe the bone, the deepest of the structures. So that the management will become, it's not only the management of a wound as otherwise. In otherwise, the wound management is comparatively simple. If there is a discontinuity of the tissue, you try to merge that or join the edges so that the gap between the tissue is lesser. But in case of a compression injury, that kind of a simple approach would not be enough. You will have to consider the possible complications produced due to involvement of the huge variety of the tissues. It could be the muscles, it could be the tendons, ligaments, bone, or so on. And there is also a possibility of the vascular injury, and hence the management will be more complicated. Then there is another variety of injury is sorry now. Please ensure that all those who are attending, they have to keep their mic muted. Another variety of the injury is the abrasions. In the abrasions, it's where the surface of the body is involved, very superficial injuries, where there will be only the surface is involved, and there may not be a deeper injury. Though it looks like a relatively simple injury, it can be quite painful, and later the scar could be quite significant. So management of this would be is having a totally different approach. It's not the tissue loss which is important, but it's about the sensitivity of the area, and because a wider area is exposed, complications like sepsis are more in case of the abrasion injuries, and that's called as the Ghrishta. Now, this is one way of classifying the acquired injuries or the Agantuvranas depending upon type of injury. Now, the Agantuvranas also are classified depending upon the involvement of the tissues, and they are either Tvakgata, Mamsa, Sira, Snayu, Sandhi, Asti, Kostamarmani, iti, Astau, Vranavastuni. Sushruta says there are 8 of these structures as the Vranavastu are the base or the location where the wound is identified, and hence the management would be considering the function of these organs also. The features would be in case of a Tvakgata Vrana, superficial injury. I don't translate Tvak as a skin, it's a skin plus the adipose tissues, the superficial injury. There, usually it will be either a Ghrishta Vrana or Chinna Vrana, where either the surface is eroded or there could be an excision. And in such conditions, the oozing would not be quite significant blood loss, but it could be the serous discharge. Characteristically having a serous discharge, subcutaneous serous discharge, is a sign of a Tvakgata Vrana. And of course, it's well known, like if the lesion injury is not beyond the level of dermis, then there will not be a frank blood loss. A area involving the epidermis and a part of the dermis would have only the serous discharge. So it's assessing the depth of the wound by assessing these the features of the Tvakgata Vrana. And Sushruta has used the word Salila Prakashaha Asravaha. Salila Prakashaha in the sense watery, where no specific color. Then the next is the Mamsagata Vrana, a deeper layer where it has crossed the fascias. And in that condition, the typical features would be, the discharges would be Sarpi Prakashaha, Sandraha, Shwetaha, Pichilasta. The discharge would be thick and maybe either pale color and often maybe appearance like the ghee, in the sense more fat containing discharges. This quite often seen in case of injuries involving the adipose tissues, deeper plane of the adipose tissues. The fat tissue which can be leaked out would have the same appearance. Or in case of an infective lesion, you can see exactly the same. I think you can make out that in case of a deeper injury, the discharges would give you an idea like whether the fat tissue is involved or not. Then the Siragata Vrana. Siragata Vrana is where the vascular injury, the blood vessels are involved. Of course, Sushruta has used the word like the Raktaja Pravrutti, where there will be frank bleeding, and the bleeding is compared to a Toya Nadi, like a tap this fluid flowing from the tap. Of course, in a vascular injury, if it is an open trauma, the bleeding is expected. But it may not be only the bleeding. If there is not a disruption or a complete hemisection of the vessels, and if the vessels are compressed, there could be even a blockade by the clot formation. So a contusion injury of the blood vessels can result in a compression or a blocking. A dehiscence of the vessel or a incision of the vessel can result in a frank bleeding. Or in addition to that, there is one more, there could be concealed bleeding. If there is a tear of the blood vessel, but the surface is not open, there could be a blood loss, and the blood loss may not be seen from outside. It could be into the body cavities or into the sheets of the space between the tissues, and a concealed blood loss could be the other common complication as such. So, Rakta Ati Pravurtihi in the sense, it doesn't mean only the visible blood loss. At times, it could be invisible blood loss, and or even it could be evidence of a compression and blockade of the circulation beyond the area of the injury. Then the next is depending the Snayugata. Snayu often is in usual translation, it's translated as tendons and muscles, but it's not only about the muscles and tendons, it's about the deeper structures which are the suspensory structures, including the joint ligaments. Part of the structures of the joint also can be considered as the snayu according to Sushruta. And in that condition, because you have a relatively less vascular area, the characteristic discharge would be Ghanaha Singhanika Pratimaha. The discharge would be thick and it's compared to the phlegm which comes out. Or Saraktascha, evidence of the bleeding. I think you can make out the clear-cut appearance of the same in the image which is accompanying that. Then the Astigata Vrana, the further deeper wound where the bones could be involved, and in case of the Astigata Vrana, the typical feature would be the Shukti Dhautam Iva, where the discharge would be something like lime water. It may not have much of a stickiness, and or even a bone marrow could be identified. Characteristically, in case of the osteomyelitis condition, so the involvement of the bones, the characteristic sign which we make out would be, it's what we call as the teardrop sign. Teardrop sign in the sense, if you put a pressure around the wound area, the flow doesn't increase, but the flow of the discharge will be continuing on its own, like the teardrops, drop by drop. Edges of the wound would be inverted, and if you use a probe, the probe may hit into the area of bones, and you can either feel or you hear the sound of that. And these are the features in case of the Astigata Vrana, and they can be easily clinically identified. And of course, the management also would be having more complex issues in dealing with that. Then Sushruta has made out a specific variety, the Sandhigata. Sandhigata, where the joint is involved. Of course, it's not a wound now. When we say Sandhigata, it may not be really a wound, but a lesion, inflammatory lesion involving the joints, which is characterized by the effusion, the fluid in the joints. Either it could be hemarthrosis, there could be blood in the joint, or it could be bioarthrosis, where there could be pus later formed. But once there is a fluid in the joint, the characteristically the synovial space is increased, and hence you will be seeing that surface abnormality as well as the range of movements would be affected. Range of movements like flexion, extension, or the rotation, whatever the possible range of movements in that particular joint would be affected, and that's exactly what Sushruta has mentioned as a akunchana, prasarana, unnamana, vinamana, pradhavana, uttasana, pravahanesha. These are the areas or different varieties of the movements which can either produce the pain or their movement may be reduced. If at all you aspirate the fluid, then the fluid would be either pichilaha, avalambi, sarudhiraha, unmatitascha. The discharge would be slimy if it is a joint fluid which is aspirated, or even it is infected, it becomes thick pus-like avalambi, or if it is only the trauma, hemarthrosis, then it is the sarudhiraha, where there could be the evidence of the blood with some clots, unmachitaha, where a irregular consistency of the blood could be seen as such. Then another variety of the wound which has to be assessed clinically would be the Koshtagata, whether the visceral structures are involved or not. Koshtagata is not only the abdomen, it's both abdomen as well as the thorax. And in that condition, the characteristic feature would be discharges from the cavities, the contents of the cavity seen over the wound. They can be seen in any kinetical way, penetrating injury in a Viddha, it could be a complication if the injury is involved or if the injury has involved a visceral structure or not. And these again would be having a different approach to the management. Anyway, that's one way of assessing the wound. So assessment of the wound based upon the shape of the injury and based upon the depth of the wound is one way of assessing the wound. Another way of assessing of the wound is based upon the shape, because ultimately shape is one of the important factors which decides about your approach to the management. And based upon that, we now classify the wounds into tidy and untidy wounds. Sushruta has mentioned the shapes which are tidy. He has described that shapes in detail. Ayataha, chaturasraha, tesraha, mandalinaha, ardhatandra pratikashaha, vishalaha, kutilah stata, sharava nimna madhyascha, yava madhyaha tatakare. The shapes could be ayataha, rectangular, or chaturasraha, somewhat again square-like, or tresraha, triangular. These are the structures which are comparatively easy to be treated because they have a regular border. A suturing or approximation of the edges of the wound would be easier, and they can be categorized as the tidy wound. Whereas mandalinaha, a circular wound, a wound which may have a circular shape, or ardhachandra pratikashaha, semicircular, where the tissue loss would be more, and hence you will have to adjust some arrange in such a way that you will be able to approximate something. A trick has to be done, some tricky approach is needed. And then in case of the Vishalaha, very broad wound, Kutilaha, irregular shape, or Sharava Nimna Madhyaha, Eva Madhyaha, where they suggest about a major tissue loss, you will have to think of either replacing that volume of the tissue loss by a graft or certain specific methods by which you can have to plan the management as such. So these are considered as the wounds, the shapes of the wounds which could be seen, but in case of Agantu Vrana, the shape could be of any shape. So you will have to assess the shape and then plan the management. And if you have a proper knowledge of the shapes of the wound and then have a trick a tricky approach, an intellectual approach of dealing with these shapes, then Sushruta says you will be able to handle any case of the wound and you will not get confused when you treat the wound. Bishop Vrana, a surgeon who has a well awareness of the possible shapes of the wound and knows how to deal with those irregular shapes, he will not be confused in the practice, even if the wounds seem to be quite serious. I'm just showing you some of the examples. A tidy wound where the shape is regular, a untidy wound where the shape could be highly irregular, and you need to have some of the tricks of management. Again, though we will not be able to go into the details, I'll go show you some of the examples, some simple examples. A wound which is having a huge tissue loss, a Nirgata, where the shape has become either it could be Yavamadhya or Nimnamadhya, where the area is lost. To cope up with that area loss as such, a surgeon can do this kind of issue. You can have a Z-shaped or irregular shaped or zigzag incision on both the sides so that this tissue, skin tissue can be stretched. And then at the end, you can suture this wound, the gap could be covered. And this zigzag wound again can be covered by stretching the tissue. So this is one way of dealing with that. Of course, the techniques of dealing with this untidy wound to convert to the tidy wound is innumerable. It depends upon your imagination, your potentials. Now another example, if there is a circular wound and you cannot approximate the edges directly, you can have a extension and a pull-out plan. A pull-out plan, see, if there is a wound of that sort, you have to have a cone-shaped incision, and that tissue which is gained by that incision could be just pulled out, stretched to cover the wider area, and at the end of that incision, you can have a triangular wound. Convert that circular wound into triangular wound, and then have an approximation. So conversion of a untidy to the tidy and converting a irregular shape to the regular shape is one of the basic approaches to the wound management, where it's not about the theory, it's not about the tissues, but it's about your intellectual planning. Now, that's about the assessment of the wound as such. The next part of the wound is the wound healing. Wound healing is a spontaneous process. There is a very popular statement like surgeon who was supposed to be the father of current surgery, modern surgery. His statement is, I cut and he heals. The healing process occurs spontaneously, and according to the current approach of physiology, there is nothing which we can do to make the wound heal. All that what we can do is create an environment where the natural ability of the healing is not affected. Now, the process of the healing is studied under 4 steps. The hemostasis, the first of the step, where the leaking blood has to be stopped. It's a spontaneous process. Then, but Sushruta has given you an idea of intervening, like how to deal with that. Then, in the contemporary system, the whole approach would be to minimize the damage or minimize the complications that can occur during the healing as such. So we'll try to deal with that step by step. The next of the step is the inflammation. So once there is an injury, inflammation is inevitable, and every wound will have a stage of inflammation. Then the proliferative phase. Next is there will be a process of new tissues being generated, and they try to fill up the gap which is formed by the wound. And the last is remodeling, like the new tissues which have come to that area and fill the gap, they have to restructure in such a way that the appearance of the area is close to the normal. The normal shape is maintained. So these are the 4 phases of the wound healing which occur naturally, spontaneously, and all that a surgeon has to do is ensure that these natural process continue without any interference. Now, we will just have a brief discussion of each of these processes, like how they occur. Once there is an injury, naturally the blood vessels will be injured and there will be bleeding. And that area of the bleeding would be having a spontaneous clot formation. The clotting factors in the body would be plugging that area, and the whole the physiology of clotting is a very detailed issue. To make it very simple, it's a thrombin which is converted into a fibrin. So whole process will be a insoluble substance is converted into, sorry, a soluble substance is converted into an insoluble substance. Now, the clot formed would be depending upon, one is the size of the area. If the area is quite big of the wound, then the clot would be quite big and it may not be able to sustain, it may not be able to block. If a major vessel is injured, a spontaneous clot may not occur. So you will have to do some process by which the bleeding can be reduced. Hemostasis could be achieved either by ligation of the vessel or compression or so on, or cautery and so on. The other procedures by which the blood loss can be reduced. So the important two aspects are, one is the flow of the blood. If a major vessel is injured and the clotting cannot occur by itself, then you will have to ensure that the blood bleeding is reduced and a spontaneous clot could be formed. Another is the gap. Bigger the gap, even if the clot is formed, it may not sustain, so you will have to minimize the gap. These are the two basic approaches to ensure that there is a hemostasis. Sushruta has described this phenomena or this protocol as like underway, like Chinna Bhinna Tata Viddhe Kshate va Asrigati Sraveta. In Chinna Bhinna Viddha Kshata wounds, the quantity of the blood loss could be more, and hence you will have to ensure that the bleeding has to be stopped. And to arrest the bleeding, the methods mentioned by Sushruta are Sandhanam, Skandanam Jaiva, Patanam, Dahanam Tata. Sandhana is a application of a Kashaya Rasa Dravya, hemostatic substances over the area, so that there could be a vasoconstriction, and Skandana, application of a cold substance, cold packing, by which capillary bleeding can be arrested. And then Pachana is a unique technique of Sushruta, where a Kshara can be used to make the blood vessels constrict, or it could be cautery, Agnikarma. Now, Sandhana also could be understood as the Sivana, the suturing. Suturing also is one of the mechanisms by which to do that. So it's exactly almost same, but in the contemporary system, you may not have a Kshara, you may not have the facility of a Kshara Sudravya being used, but hemostatic substances are being used to reduce the bleeding. In general, when you do not have to follow those standard protocols for a massive bleeding, a general approach would be Shitam Alepanam Karyam Parishekasya Shitalaha. Application of a cold lepa or a Shitavirya Dravya, it helps in reducing the bleeding, as well as it also can help in reducing the possibility of the next phase, that's the inflammation. Inflammation is considered as a Vrana Ushma by Sushruta. So in all case of Agantugana, Sarvasminne Agantugane, तत्कालमेव श्रुतोष्मणः प्रस्तुतस्य उपशमार्थं पित्तवत् शीतक्रिया अवचारणविधि विशेषः. So in itself, the शीतक्रिया, the cold application of cold, either a cold to touch or the शीतवीर्य द्रव्य, or it could be sandhana dravya, and one of the commonly used dravya is madhu ghrita, application of the madhu ghrita over the area. These are the major primary approaches to reduce the bleeding. So first step. The next step of the changes which occur in the case of a vrana or injury is inflammation. Of course, inflammation is defined as a reaction of the tissue to a sublethal injury. When an injury has occurred to any tissue, the tissue reacts, and the reaction would be either to approach, like either if the tissue is injured beyond a limit of survival or non-viable, then that tissue has to be removed, giving scope for new tissue to occupy that area, or if possible, the tissue has to be repaired, replaced, the injured tissue has to be replaced. So approach of the inflammation would be either to repair or to give remove the debris and give the scope for the new tissue to be formed. Of course, well-known theoretical description of the clinical signs of the inflammation are the pain, the tenderness, pain or the tenderness in the area, reddish discoloration, rubor or as such where the reddish discoloration, temperature being raised, the raised temperature, and impairment of the functions. These are considered as the clinical signs of an inflammation. Now, the changes which occur during the inflammation are very crucial and important. The first of the approach to the inflammation at the area of the inflammation would be once there is an injury to the tissues, the immediate response would be there will be a vascular response. Vascular response would be the blood vessels there would be dilated, the capillary pore size will be increased, and when the capillary pore size is increased and the blood vessels are dilated, there will be more blood flow and the cells can migrate into the interstitial space. The major cells which can migrate would be the phagocytes. Phagocytes are those which can swallow any of the cause of the injury. They can swallow either the cause of the injury or they can swallow even the tissue which is dead. Now these are mediated by, the whole process is mediated by a series of chemicals which are called as a tissue amines. Tissue amines are released from the area where the tissue is injured, and or even the tissue amines will be released by the released from the liver as whenever there is a inflammatory pathology in the body. So you will have different varieties of the amines which are released. These amines will have a function of either stimulating the process of inflammation like vasodilatation as well as the cell migration. They are either stimulated. At the same time, they also have the function of conveying that there is an injury to the tissues to the higher centers of the body so that the body will be able to fight with the inflammation better. So that there will be whole the response of the body to a area of inflammation is not only local. There could be systemic effects. Systemic effects like the total metabolic rate would be enhanced. There will be migration of the cells which are needed to go over the area. When there are toxins released to the circulation, then they have to be neutralized by producing immunoglobulins of the specific sort. And once the inflammation is over, then there would be a process of healing which is stimulated, and all these would be regulated by the hair center. So the mechanism of these tissue amines is a very complex mechanism, and they produce a huge chain reaction. We will not go into the detail of all of that, but certain of those which are quite important from the basic point of view are among the tissue amines which are released locally, the most important and the commonest as a result of a injury, blunt trauma. Whenever there is a tissue injury due to either a blunt trauma or a cut injury with a sharp instrument, the serotonin is one of the highest, rather the maximum quantity of the tissue amine released, and the major functions of that would be it will be acting as a neurotransmitter. So the sensation of the pain produced due to the injury is mainly due to the serotonin. So pain is the important feature. Whenever more serotonin is released, the pain will be more. So you may have that kind of an experience. Some of the wounds may have more pain, whereas some of the wounds, though they may look to be more severe, you may not experience the same amount of pain. The intensity of the pain felt is related to the amount of the serotonin, and the severity of the pain also is related to the type of the tissue amine released over there. And the tissue amine serotonin also has a primarily vasoconstrictor effect so that the hemostasis is achieved. So this is the first response. And these symptoms are exactly what you see in case of a vitiation of the vata. Vata is the one which produces a severe pain. Another common variety of the tissue amine which is released due to the injuries of different sorts would be the histamine. Histamine is often released when the tissue is injured due to some chemical injuries. May not be the trauma, but when there is a chemical injury produced, something like a sting bite or so on, or poisonous substances, or which we generally name as allergy commonly. In that condition, the histamine is released to the area, and the major effect of the histamine would be it produces the dilatation of the blood vessels, and it facilitates movement of the cells to the area, particularly the pigmented cells coming to the area, eosinophil cells coming to the area as such. And once the histamine is released, the common feeling felt at the area, the symptom felt at the area is itching. I think most of you might have experienced that, and that's what Ayurveda recognizes as the vitiation of the kapha. The characteristic environment signs of kapha prakopa are the kandu or the itching. Another of the tissue main, common variety of the tissue main release is prostaglandin, which are again commonly presented in not in the tissue which is injured, rather they are present in high numbers in the histiocytes, the macrophages, mast cells, endothelial cells, which are really the defensive cells. The cells which migrate to the area of the injury, they contain more of prostaglandins, and they facilitate the whole mechanism of the vascular reactions to the inflammation, as well as the systemic reactions of the inflammation. When I say the systemic reactions to the inflammation are, again, primarily they are categorized into 4 stages. The first stage is what we call as the febrile reaction. The febrile reaction is that once there is a inflammation in any area of the body and the toxins are released to the system, the body temperature will be raised, and that mechanism of body temperature raised is by regulation of the impact on the thermal regulatory centers at the base of the brain. But the main purpose of raising that body temperature is to ensure that the metabolic activity in the body is at a faster rate, and there is a more of energy released. See, when the energy is released, naturally the heat generated will be more, and when the temperature is raised, the energy released also will be more. So this is exactly how the body is preparing to meet with that toxic effect of the inflammation, and that's regulated by the prostaglandins. The temperature of the body would be raised. The febrile reaction is a consequence of the inflammation as such. Of course, this is exactly what you see in case of the pitta prakopa. Now, because we have referred to the consequences of the inflammation, the first stage is the febrile reaction. We'll just deal with the other phases also. The next phase would be there will be a impairment of the gastrointestinal tract function. The second stage of toxicity produced due to the inflammation will be the gastrointestinal tract motility will be reduced, and the usual experience will be either you may have a reduced appetite or you may have vomiting to keep the stomach empty. Now, this also has a important message to the body. The important message is the maximum amount of the energy is utilized to digest the food which you have consumed. So if you have to fight with the disease, like the inflammation, then to conserve the energy, the body deprives that, stops that mechanism of digestion. So the most maximum energy consuming activity done by any human being is digestion of the food. So we may think the other way. We may think that the energy is spent when you do the exercise or when you hear the classes and so on. But reality, the maximum energy is utilized when you digest the food. Consumption of the food and digestion of the food is the maximum energy consuming activity. And the purpose of shutting down this gastrointestinal tract by the body is to ensure that that kind of a maximum energy consuming activity is reduced, and the body is well prepared to fight with the inflammation pathology. And this also has a basic relationship with the idea of managing the jwara with the langhana. The approach to the management of jwara in Vyadhi is the langhana, to reduce that load on the gastric tract as such. So that's the second stage. The third, these two are the stages which suggest that the body is able to fight with the inflammation, and there is a chance that the body can win over. But in the next stage of the inflammation, it may result in a failure stage where the body may lose the fight, and in that condition, there will be a multi-systemic involvement where the other organs of the body, like the kidney or the heart, may be affected. And then the fourth stage is the evidence of toxemia or septicemia. These are the failure stages. Okay, we will not go into that part, which are the complicated stages. But primarily, the three stages are the stages of the first two stages, the stages of the febrile reaction and the stages of the gastrointestinal tract shutdown. These are done by the prostaglandins. The prostaglandins are the major substances which regulate these functions. And when their role is not enough to manage, then it may be result in the other complication like the failure stages. So that's not the point which we are going to discuss. Now that inflammation process is described by Sushruta as a Vrana shopha when it is seen locally as a result of the trauma. Now, inflammation can occur due to non-traumatic injury also, but that non-traumatic injury is a different issue. We will not deal with that part. So we will now deal with only the inflammation produced due to the injury, tissue damage, mechanical damage, and that's considered as a Vrana shopha. Now, there is again quite a confusion between these two words often among the Ayurvedists like Vrana shopha and the Viddha. Kshata has clearly described Vrana shopha as a stage where the inflammation is not localized. Tutuhu gratitaha. When it's a not localized, the borders are not clearly palpable. And Tvakgata, when it is superficial, then that's considered as the Vrana shopha. Whereas when you have a border, a clear-cut border palpable, and when the location is deeper, then it's considered as a Viddha. So there is a difference between that Vrana shopha and the Viddha, as well as the shopha samutthana vyadhis. Shopha samutthana vyadhis are those where you have a swelling with a clear-cut defined border. Anyway, those shopha samutthana vyadhi are not the context of our discussion now. So present discussion would be only about the Vrana shopha. Now, Vrana shopha could be again presented due to involvement of the doshas. Sushruta has described those clinical signs, so you can identify them clinically when a patient presents with an inflammatory swelling. The evidence of the involvement of the dosha can be seen clinically by simply looking at the features as such. When the swelling has a blackish color, Krishna Arunova, and where there is acute pain, as in which is a sign of either a hyperemia, increased blood flow, or it could be a sign of reduced blood flow, where there is a vascular phenomena in case of an inflammation, where either the blood flow is reduced or blood flow is increased due to the stasis of the blood. Both these conditions would be considered as a Vartaja shopha, where the pain will be more. Pittaja shopha obviously would have all the clinical signs of acute inflammation, where the swelling will be Voshadaya, temperature will be raised, and Saragata, there could be even reddish discoloration. All that classical clinical signs of the inflammation would be more, and it ends in pus formation. Pitaha, Mruduhu, the swelling tends to become soft or yellowish in color, and that kind of feature is considered as the Pittaja shopha, and this can be easily made out clinically. Kapha shopha is usually a sign of granulomatous infection, chronic inflammatory pathology. And in that condition, the swelling will be comparatively firm and the temperature is not raised. The course of the disease is slower. So these are typically seen as in case of a tubercular lesion or lepromatic lesion, so on. These are the features which we see, and they can be easily made out clinical. Then there is another variety, the Raktaja shopha. Raktaja shopha is where there is a massive tissue necrosis and then there is a bleeding. Sushruta has mentioned that it is has all the clinical signs of Pitta, but at the same time, along with that signs of inflammation, there is a increased vascular damage. The serous collection seen due to that Atik Krishna, black color produced due to that stasis of the blood around the area, along with the inflammation. That's a sign of Raktaja shopha, and these can be seen clinically. Then, of course, there is another Agantaja shotha. Sushar has described this in case of a trauma. It can be having the features of Pitta Rakta, but and the signs of blood stasis can be seen due to the trauma. A traumatic shopha also is described as a variety of the shopha. So, inflammation produced with the trauma also is mentioned. Sannimata shotha, when you have involvement of all the doshas, it can result in huge necrosis of the tissue, and you will have sarva varana vedana and vashvayatu, a huge gross deformity, which we call as a wet gangrene. There will be necrosis of the tissue, death of the tissue, and infective pathology. All that put together, that's the sign of the Sannipata shotha. Now, anyway, once the inflammation has started, we have just referred to that beginning in the beginning. We'll continue some more aspects of the inflammation. The inflammation again is categorized into two, either an acute inflammation or a chronic inflammation. The acute inflammation is that stage where the phagocytosis would be enough to manage with the source of inflammation. The phagocytosis would be either ending up with that whole course of inflammation, and the repair process may start immediately. And this also is called as primary healing. We'll have more discussion about the primary healing next. Or it may be in such a way that the inflammation may result in removal of the tissue also, debris also, as well as there will be huge loss of the phagocytes, resulting in what we call as the pus. A pus formation may occur, or that tissue gap could be more, and that area which is filled up, which has to be filled up, has to be replaced by a different type of the tissue. That's the fibrous tissue has to come to the area. The inflammation has to be localized, limited, and then the process of the healing has to start, and that's considered as the chronic healing. So in acute inflammatory pathology, is mainly the vascular responses, WBCs come over there, and the next phase would be the normal tissues will be regenerated. That's what we call as the primary healing. Whereas in a chronic inflammation, there is a tissue loss. The initial stages will be the same, but later it will be the fibrous tissues coming over to the area, and you will have a scar. So these are the adeha dharana. The scar will remain in the body for the whole of the life. This is what you see under the microscope. Now, inflammation also can result in a pus, and pus is actually accumulation of that substance of both phagocytes as well as the tissues which are damaged, and the pus may limit over the area, and it may remain, the pus may remain at the area surrounded by the fibrous tissue, and that's what we call as the purulent inflammation, or at times it's also called as the abscess, Viddha. Now, the same these phenomena are described in Ayurveda with the stages of the shotha in terms of the presuppurative or ama and pachamana and akvavastha. Amavastha, mandoshmata, tvaksavarnata, shita shopata, sthiryam cha, mandavedanata, alpa shopata cha. These are what we see in case of a mild acute inflammation, where there will be local swelling, and often either it may end up that itself a mild injury, mild inflammation. It may end up without going to the next stage. It may just heal, and you may not have any evidence of that. Or a amashopha can result in a pachamana, where there is a possibility of the pus formation. And this course is the one which would be more painful, and there is always a chances of the dissemination. The systemic features of the inflammation would be seen more, and Sushra has described these features where there will be acute pain, and the description of the pain would be like elaborate description, like bitten by ants, pipilaka damshateiva, or chidyateiva shastrena, as if it is injured with a sharp weapon, and so on. So acute pain would be the major clinical sign over there, and at the end of that, it may result in the fluctuation. Adnata bastiriva atataha. Clinical signs of the fluctuation, the presence of the fluid formation, or a suppurative ending is the course of inflammation. From the present approach point of view, that inflammation, the suppurative condition is considered as a complication of a inflammation. But Ayurveda considers that suppuration as a paka, a natural sequelae and possible termination of the disease. Sushruta has special measures by which this process of Pachamana Shopha can be shortened and controlled. So that comes under the Shastri Upakrama. Later, when we discuss about the Upakramas, the management of the wound, this part will be important, where Ayurveda has a unique special approach of regulating this process of the inflammation, controlling the process of inflammation, and the inflammation being considered as a natural sequelae which can terminate the disease than really being considered as a complication. So that part we will discuss later, maybe when we discuss the next phase. Now, the next stage is the Pakvavastha, where the pus is formed. And once the pus is formed and the inflammation is localized, the barriers are formed with the fibrous tissues, then the intensity of the pain will be reduced. The systemic clinical signs also will be reduced, and this is what we consider as the Pakvavastha. The suppurative stages of inflammation are categorized by Ayurveda as the ama, pachamana, and the pakva with more detail than what we see in the present situation. And of course, the clinical signs will be the reduction of this intensity of the pain and that typical fluctuation elicited due to the accumulation of the fluid, and even a spontaneous discharge, a pariputan, there could be a spontaneous opening and pus may get discharged. Now, and once there is a discharge and opening, it results in a Vrana. So, Vrana shopha can end up in Vrana. a wound can occur. This is what Sushruta says as a Nija Vrana produced due to endogenous pathology. The point of confusion I think I have referred to, in the present day situation, inflammation is not considered as endogenous, whereas Ayurveda considers this as endogenous due to the consequence of the doshas. Now, once there is a Vata Dushta Vrana, the clinical signs will be there will be a Shaba Arunabha, bluish or reddish discoloration, and the discharges will be comparatively lesser. There will be more pain and abnormal sensations, either tingling sensation or numbness at the area. These are the typical features of, and there will be lesser healing process. Nirmamsa, the granulation tissue will be absent, as you see over the picture there. That's the typical of a Vata Dushta Vrana. So all that point is they can be identified by the clinical evidences. And that's exactly what we now consider as a perivascular inflammation. A inflammation pathology where the fibrous tissue would be formed around the vessels, and hence the vessels will be stagnated, and there will be stagnation of the blood elements over the area. That's the perivascular inflammation, which are seen in case of the Vata Dushta Vrana. A Pitta Dushta Vrana, it will be having more of pus discharge, rank pus discharge, and pus discharge could be of any color, Pitanilabha, either yellow or bluish or reddish in color, Kimshkodabha as such, and the clinical signs of inflammation would be quite significant. Now, another important issue is that in the present bacteriology, the color of the pus is supposed to be as a consequence of the type of the organism. Organisms like Escherichia coli often can produce a greenish color pus, and a Staphylococcus can produce golden yellow color pus, and so on. So depending upon the organism which is involved, the color of the pus is identified. Sushruta considers this as a consequence of the dosha drushti. Depending upon the type of dosha and the intensity of the dosha drushti, the color of the pus should be varying. Maybe both the views are correct, or both the views may not be having a absolute correctness. So we'll not go into that controversy as such. Then the next is the Kapha Dushta Vrana, where characteristically the clinical signs will be of a fibrosis, chronic fibrous wound, where the surface would be hard, edges tend to be raised, the keratin tissue will be raised, the hyperkeratinization is a characteristic feature. Sensation of the pain also would be lesser, and the wound may be firm. Discharges would be very thick acid. These are what we see in case of most of the times the pressure sores, or where the growth factor, trophic ulcers. The usually used word is trophic ulcers, where sensation as well as the vascular responses are reduced. These are the features of the Kapha Dushta Vrana. Rakta Dushta Vrana is again hypervascular, where the amount of the blood flow is increased as a result of the inflammation, as well as there could be some direct pathology related to the vessels, as in case of the vasculitis. Vasculitis, you have different categories: the small vessel disorders, medium vessel disorders, large vessel disorders. All of them would be showing the signs of the Rakta Dushta Vrana, and characteristically there would be Krishna spot of Pittaja, where there could be blackish eruptions, blood found, and that fluid is collected over there, or the color could be bright red like Prabhaladala Nichaya Prakasha, like that of the coral. These are the typical signs as such. And the smell is Turangasthana Gandhi, like the horse shed, the urine, ammoniacal smell. Usually we now consider ammoniacal smell as a sign of a gas producing organism. So that's the point of difference. Anyway, we'll not go into much of that issues. Then Dvanda Javranas, if it is a Vata Pitta Javrana, there would be a Pitarunabha Tadvarnasrabi. There could be either a reddish or yellowish colored discharges, and there would be signs of inflammation. Again, we have referred to that issue. The pus color, now we consider this as a consequence of the organism, but Sushruta consider this as the consequence of the dosha drushti. A Vata Kapha Vrana, there again the sensation will be impaired, reduced, and the surface will be hard, rough as such, and the discharges will be very thick. Again, trophic ulcers with comparatively lesser discharge and a relatively much harder hyperkeratinization, they can be considered as a Vata Kapaja Vrana. Pitta Kapaja Vrana is where there would be Pitta Pandusravi, a whitish discoloration, or maybe signs of acute inflammation, Ushna, usually whitish discoloration now is considered as a streptococcal pathology, whereas Sushra had considered this as a Pitta Kapaja Vrana. Then you have the Vata Raktaja Vrana, where the circulation is impaired, so there will be the wound will be more painful to the Bahulaha, and the color would be Rakta Arunabaha Tadvarna Srapija. These are the evidences of again vascular involvement, where usually either the bigger vessels are involved and there is a ischemia, the reduction of the blood flow there. That's the typical of that. Then Pitta Rakta Dushtavrana. In that condition, Sushruta says there will be Ghritamandabaha. The discharges will be something like ghee, like a thick fatty discharges are produced, and the smell would be a fishy odor. Meena Bhavana Tvayagandhi. The discharge will be the fishy odor. Again, I think the same point, like when you have a fishy odor now, you suspected the maybe Clostridium groups of the organism. But Sushruta says it is the result of Pitta Rakta Dushtavrana. And Mruduhu Visarpeja, it tends to spread rapidly, and the condition will be somewhat rapidly progressing. That's the typical of Pitta Rakta Javrana. Then Kapha Rakta Javrana, the features would be there would be harder tissues, and the color would be reddish in color, and Sarakta Pandusravi, hemorrhaginous discharges are a characteristic feature. Kandu Prayaha, itching could be seen, and that's the typical of Kapha Rakta Javrana. And then, of course, you have the Dosha Javrana, Vataja, Pittaja, Raktaja, where there would be acute severe pain, sensations are impaired, and the discharges will be again hemorrhaginous, which is often seen in a chronically inflamed vascular injuries, chronically seen vascular injuries like varicose ulcers or ischemic ulcers with a secondary infections. These are typically seen as a Vata, Pittaja, Raktaja, Vrana. Whereas Vata Kapha Raktaja Vrana, Dosha Javrana, where you will have Kandu Spurana Chumuchmayana Prayaha Pandu Ghana Rakta Sravi, where there will be whitish thick discharge, more of slough containing ulcers. When there is a soft tissue injury and more of slough there, and of course, consequence of the ischemia also, they too can be considered as a the Vata Kapha or Rakta Javrana, Dosha Javrana there. Then Pitta Kapha Rakta Javrana, Dosha Javrana, there you will have a thick Srava, Pandu Ghana Rakta Sravi, and Pitta Shleshwan in the Lakshana. The same clinical features of the Kapha Pitta Javrana with the more of vascular signs, they are the Pitta Kapha Rakta Javrana. And of course, the Sannipathaya, where all the doshas are involved, is a very typical sign of vast necrosis, huge gangrene and necrosis with the secondary infection, wet gangrene like features. These are the dosha Javrana Lakshanas. And all four doshas, Vata, Pitta, Kapha, Rakta variety, you will have again all the gangrene as well as a deeper involvement of the tissues like the bones, and there is an impairment of the sensations also. Swapa Bahulaha, numbness also accompanied with that, often seen in case of the lepromatic ulcers. These are the typical of the Vata, Pitta, Kapha, Raktaja, Vrana features as such. So all that point is that all these dosha lakshanas can be identified clinically, and whenever you see a patient of wound, these dosha lakshanas can be assessed. So that's about the stage of inflammation and the features of inflammation described by Ayurvedic point of view. Of course, approach to the management will be depending upon the stage which you have seen and the type of dosha involved. Now, the next phase is that of the wound healing or the proliferation phase. In the proliferation phase, the changes which occur would be the fibroblasts will be migrating to that area. Fibroblasts are present in the tissue. Either in every tissue you will have the fibroblasts, or the fibroblasts can be moving to the area, and they are part of the connective tissues or the collagen tissues of the body. And fibroblasts initially would be bigger in size, and once they plug the area of the injury, then they may become, as they develop, their size becomes thinner or smaller, but the consistency of that collagen tissue would be harder. It will be polymerized. It's the hydroxy proteins present over there, which will be polymerized, and the density will be increased, and hence the tissue becomes strong. Fibrous tissues are those which can survive in a hostile condition. They do not need the same amount of blood supply. They do not need the same amount of the energy as other tissues. and they are mechanically stronger, and hence they occupy that area and fill up the gap, and that's the stage of proliferation. Migration of these fibroblasts is what we say as the state of proliferation. But a proliferation of the wound healing also can occur without that fibroblast if the gap is smaller and the whole course of inflammation is shorter. Then the gap may be filled up by the same tissue which was lost. Like if it is a skin tissue injured, then the gap may be filled up by only the skin tissue. Then such a condition is called as a primary healing. When it doesn't occur and it has to be replaced by the fibrous tissues, then we consider this as a secondary healing. The basic difference is in a primary healing, it occurs in a shorter duration, usually 7 days, all in average, whereas a healing by fibrous tissue, secondary intention, it takes about 3 weeks minimum. And area where the primary healing has occurred will not show a visible scar because it's covered by the normal fibrous normal tissue. It could be the skin tissue or the back tissue or so on, which is injured. Whereas in case of secondary healing, you'll be able to see the scar because that area is filled up by the fibrous tissue as such. So that's the feature. And then all the signs of inflammation, the clots, exudates, and all the signs of inflammation will be milder or non-identifiable in case of the primary healing. Whereas in secondary healing, all that process will be more, and the new vessels formed in the area also will be more in case of the secondary healing. And usually the secondary healing takes at least 3 to 4 weeks as such. The changes which occur in the cells are when there is a inflammation. In the first 1 week of inflammation, there will be more of cellular response. The leukocyte count will be raised, but by about a week, that cellular response will be usually ended in case of uncomplicated course of inflammation. The second week would be taken up by the macrophages, which are the static phagocytic cells. The next phase will be the fibroblasts. The fibroblasts usually start at the end of first week, and then they will be increasing, and usually by third week that will be settled down, and by third week onwards, something around the end of the second week and third week onwards, these fibroblasts will become mature, and that's the process of the real healing or reorganization of the cells, the fourth stage of the wound healing. So wound healing in very summary would be either it could be by the epithelialization or by the fibrous tissue formation, and this involves one stage of synthesis of the collagen tissue, and then there is another stage of collagen remodeling and maturation. This can be very brief description of the process of wound healing. Now these stages are described by Sushra by the clinical signs, and the clinical signs would be once there is evidence of the healing process and that new fibroblasts are formed, which we call as a granulation tissue. Granulation tissue is a group of tissues which will have new blood vessels, fibroblasts, as well as a few of the epithelial cells which cover up the area. And such a stage is considered as Rohat Vrana or Rukshamana. And once there is evidence of that, the inflammation is that acute phase of inflammation, suppurative inflammation is over, that Pakvavastha is over, and you have that followed that Shodhana Kriya, that process is called as Shodhana Kriya. You will have a stage where the wound becomes Shuddha or Rohat. The tendency for the Rohana is seen, and at that stage, the typical feature will be the discharges will be reduced, and the edges would be having Kapotorna Pratimaha. A reddish color is tend to seen, and you will have Chipitikaha, Stiraha, Chipitikavantaha. The granulation tissue would be seen over the area. And that's the clinical sign of the fibroblast formation, collagen tissue synthesis. Once the stage is stabilized, the collagen tissue has stabilized, which is usually by the end of the second week or beginning of the third week. There, the wound becomes Shuddha Vrana. Shuddha Vrana, Sushruta has described like the appearance is Dikvatalabha. The surface would have a very fine follicles, a fine uniform granulation tissue formed, and evidence of that fibroblast being spread over the area completely, and hence the area would be Suvyavasthitaha. Surface would have a regular shape, and Sakshnaha, it will look somewhat smooth, and but Dikvatalabha, something like the tongue surface, and there can be any other better description than this. And the pain will be reduced because of Vedana, and you will not have the signs of dosha. Tribut dosha anakranta, you will not have the signs of the doshas involved, and the worst, the edges of the wound would have a bluish color due to that new tissue, epithelial tissue being formed, and the mature collagen tissue also will be seen as the edge of the wound, which is the shava ostaha, is the clinical features of the Shuddha. And once the healing is over, that fibroblasts have covered the area and they tend to mature. The signs of maturity are Tvakgata samatalam. The color would be of the same as the normal, surface would be uniform, and the strength of the wound is gained. And Rudavartmanam Adrantim, there will be no granulation tissue, no hypertrophy. So the important is the phenomena of the wound healing, the stages of the wound healing are very clearly described by Sushruta, though we may now use a microscope to study. Sushruta had depended upon the clinical signs. The same clinical signs described in a microscopic evidence by day 13 or day 18 or so, you have all the signs of the Rudha Vrana, the features of Shuddha Vrana seen and under the microscope. Now, in all cases of the wound healing, the target of the wound healing would be to ensure that the viable tissues are preserved and non-viable tissues are removed. So that's the basic concept of the wound healing, which occurs physiologically. And from our clinical approach also, all we have to do is ensure the same asset. And whenever the tissue has to be restored, try to restore the continuity of the tissue and function. So there should be minimal gap. Facilitate the state condition where the wound strength is gained. So you'll have to ensure that the wound healing occurs as fast as possible, and the strength is gained as such. And then prevent the prolonged inflammation. The inflammation is, of course, inevitable, but you have to minimize the duration of the inflammation, and avoiding the complications like infections and other impediments has to be avoided. And at the end, the scar should be minimal. These are the targets of the wound healing. And Sushruta Ayurveda has described 60 protocols, Shasti Upakramas, to achieve these targets, which is again unique of the Ayurvedic approach. We will not deal with those 60 Upakramas today. We'll just keep it apart. Now, the other aspect of that would be when the wound healing has not occurred, a failed healing, signs of failed healing are either there could be an absence of the healthy granulation tissue, a granular pathology could occur as a complication, or necrosis, death of the tissue and unhealthy tissues in the wound bed also can be a sign of a failed wound healing. When there is excess of slough or excess of discharges, that too would be a sign of impaired wound healing. When the adequate blood supply is not there, failure of epithelialization, repeated pain, recurrent breakthrough of the wound, or a presence of the infections, these are the signs of a failed healing. Now, prognosis of the wound is predicted by Sushruta by assessing the discharges as well as its location. One of the important description of the prognosis would be depending upon the appearance of the discharge. When there is a inflammation or injury involving the pakwasha, the colonic structures, and if it has pula kodakasanibha, if it has rice washed water like appearance, or when it is a charodakanipa raktaja, when there is a serous discharge, when the raktashayas, the blood containing structures are involved, or amashayat kalayam bhubonibaha. So depending upon the type of the discharge, prognosis can be predicted. Of course, the factors which can impede the wound healing are either contamination or infection, more tissue loss, inadequate nutrition, tissue hypoxia, or tissue desiccation, systemic diseases. These are the factors which can affect the wound healing, and all that protocol would be to ensure that either those abnormal discharges do not occur or these factors are managed. Then one fundamental question which is always is raised now is in the present day situation, infection is considered as the most common and most frequent complication of the wound. So naturally, most of the time the question occurs like whether a antibiotic has to be administered in every case of wound or not. My answer is strictly no. There is a basic, again, we will not go into much of the detail. there is a basic difference between a bacterial contamination and bacterial infection. A bacterial infection is by the presence of significant number of the organism, and that significant number of the organism is a 10 to the power of 5 organisms in the tissue. And then only the approach of use of antibiotics would be necessary. But if you use the antibiotic otherwise, it's not going to help in any way, because either the antibiotics would not reach to the area of infection of the wound, and there will be no significant number of the organisms, and they are of no use. We will not go into more of the details as such. Now, Sushruta has identified that infection as a complication, and the Rakshogna Vidhi, which is mentioned, is mainly to prevent the infection. And the approach to that Rakshogna Vidhi would be by Bali, Mangala, Swastivachana, as well as local hygiene, the Bandhana, or the local hygiene maintained by the Dhupana. These are the approaches which are mentioned, and Raksha Vidhana are described in detail. So, Nishacharebhyo Rakshastum. Nishacharas are the bacterial organisms, Rakshasas, which can produce the complications to the wound, and those measures are mentioned. So it's not the antibiotic, rather it's the approach of either preventing those organisms from reaching to the area. But once the organisms have reached to the area, they have to be managed by either the Bali, Mangala, or the specific Rakshogna Chikitsa. Now, Rakshasas are the harmful organisms, the bhutas, which can affect the tissues. They are supposed to have two approaches according to Sushruta. Either puja michandi kechita, or some may expect a respect from you, or some may be digamsava, some may have an intention to hurt you. In the current microbiology, you have that classification of a commensal and opportunistic. Commensals are the bacteria which are present in the tissues in the body, which will be having a symbiotic relationship, and only when some of that mechanisms are affected, they may become opportunistic and then produce the damage. So they may become infective organisms. Anyway, pathogens and commensals are identified by Sushruta as the organisms which expect puja, the respect, are those which are going to harm. Now, those which expect the respect, you have to respect them giving Bali Mangala, and in other conditions, you have to treat them with the specific protocol as such. Now, once the complication has occurred, it can result in what we call as a Vrana, the infection pathology which has produced the complications. That's considered as a Vrana by Sushruta, and that Vrana is identified by the clinical signs, and those clinical signs are Ati Samurtaha, Ati Vurbukaha, Ati Katinaha, Ati Mruduhu, Utsannaha, Avasannaha, Ati Hitaha, Atyusnaha, Krishna, Rakta, Kita, Shukladina, Varnana, Anitamaranaha, Bhairavaha, Puti Mansu Sirasmai, Prabhutibihi Purnaha, Puti Puyasravi, Unmargi, Utsangi, Amanojna Darshana Gandaha, Atyartham Vedaravana, these and Pidakopudraha. Now, these are again what you can see clinically, Ati Samrutaha and Ati Vivadaha, where either the opening of the wound is very much constricted or when the wound has become dazed. These are the signs of complication. Ati Katinaha, Ati Mruduhu, when there is a stasis and the tissue has become hardened, usually lymphedema, or when there is a hypergranulation, which is complication of Ati Mruduhu, or Utsannaha, Avasannaha, a hemangioma, a hypergranuloma, which results in a severe raised surface and it becomes fragile, or even it may become malignant. The malignant changes as we call as margarine ulcer, that's Utsannaha, or when there is a fibrosis around the area and the wound has become somewhat constricted, the Avasannaha. These are what we can identify. Then Krishna Rakshapita Shukladina Varnana Manyatamaha Varnaha, where there is a slough produced due to the infections, different varieties of the slough, either it could be black, yellow, or so on, whitish, or so on. So multiple colored, which are signs of this slough and presence of multiple colonies of the bacteria, or Bhairavaha Putimamsa Sirasnai Prabhuti Purnaha, when multiple tissues are involved and there is a lot of slough, huge area is involved, that's also a sign of Vrana can be seen. Unmargi is a where there is a possibility of extension of the wound, commonly seen in case of a palmar abscess, hand infections. When there is an infection in the palmar fascial level, the infection can travel to the forearm, the flexor compartment of the forearm, and can produce the complications. That's what is mentioned as Unmarki. Utsangi is the collar stud abscess where there can be two cavities, one cavity connected to the other through a narrow neck-like structure. Usually occurs in those areas where you have a flexible shape, sheet like the fascia, the neck fascia, platysma. So that kind of the situation, that's the collar stud abscess or Utsangi. Then, of course, Amanojna Darshana, where you have a huge necrosis and slough, which will be giving a appearance which is not liked by anyone, or Pittaja, hypergranular ulcers, or the malignant changes which occur in the ulcers. These are, and Dustashonita study, hemorrhaginous wounds, where there could be significantly bleeding, as in case of a malignant change, and Dirghan Kalamandi. These are considered as the Dushtavrana's complications as such. Along with these Dushtavrana, and which occurs as a complication of the wound, there are the Vrana Upadravas, and those Vrana Upadravas are mentioned as the local signs of inflammation, Gandhadayaha, Vranas Upadravaha. Along with that, systemic complications of the toxemia, like Jwara, Atisara, Murcha, Hikka, Chandi, Arochakaha, or even Shwasa, Kasa, Avipakashta, Susna, the Branidasaja. The systemic signs of the toxemia can be the complications of the wound, and hence, in case of when you manage the wound, it's not only the local complications which have to be managed. The local complications could be dehiscence, eviscerations, adhesions, infections, etc. Along with that, the systemic complications also have to be taken into consideration, and only when you have a thorough clinical assessment of these conditions, management can be planned. So we will end up with today's discussion with this clinical assessment. The Shashti Rupakrama or the management in detail can be a later topic in due course of time. To conclude, the description of the wounds in Sushruta is very elaborate and practical. All those features which are mentioned in the text can be identified clinically, and assessment of any wound is essential before you plan a management, and assessment should be by all these aspects: the shape of the wound, type of the injury, complications which have occurred, stage in which you have seen the wound. All these are essential. And promotion of the wound healing is a unique Ayurvedic tool which you do not have in any other contemporary system. Sushruta's description about the wound is very unique. Very briefly, it is mentioned in a single shloka: Shanmulaha, Ashtaparigrahi, Panchalakshana Lakshitaha, Shastya Vidhanehi Nirdishtehi, Chaturbis Satyate Vrana. One shloka describes all that, and whatever we have discussed today is only the first half of the shloka. The next of the shloka we have not touched, so only one half of the shloka is discussed. That shows the speciality of Sushruta, where the whole a huge description can be summarized in a single sentence. With this, let me conclude today. If there are any questions, I think we will be able to answer a few of the questions. Then otherwise we will end up today. Thank you. Thank you for patient hearing.
Thank you, sir. Thank you very much for today's session. We will wait for a few minutes if there are any questions.
All right. If there are any questions, we will wait.